So good afternoon, everyone, and welcome to the first Data Science for the Public Good Distinguished Speaker event of 2021. For those of you that don't know me, I'm Sally Keller. I am part of the Biocomplexity Institute here at University of Virginia. And our Data Science for the Public Good Distinguished Speaker Series is a partnership between University of Virginia's Biocomplexity Institute, our School of Data Science, the Darden School of Business, and the Democracy Initiatives Equity Center. We want to thank the sponsors for the series for their continuous and generous support. This includes Avis & Young, the Washington Statistical Society, NORC at the University of Chicago, the American Statistical Association, our studio, Sage Publishing, and WestStat. Thank you all for joining us on Zoom today and spending your afternoon with us. I want to just say a couple words about the mission of our forum. The mission of the forum includes a distinguished speaker series, and you're going to hear one of our speakers today. We also annually have a symposium, a Data Science for the Public Good Symposium. And the purpose of this forum is to bring together the public, private stakeholders, academics, and others who want to come and discuss what it means to do data science to support the public good for evidence-based policymaking and innovation to enhance the quality of our lives. Today's speaker couldn't be a more perfect fit for this vision. Today, Vicki Vasques is the owner and chairman of the board of Tribal Tech LLC and Cohen and Associates. Both companies are American Indian, woman-owned small businesses that provide management and consulting services and technical assistance to federal, state, tribal, and corporate clients. And as you're going to see during the talk today, again, Vicki could not be a more perfect speaker to fit into the mission and vision of our forum. Tribal Tech, in particular, has a mission to improve the lives of communities across the United States. And this is actually something that Vicki has been doing for more than 30 years, not just as the owner and founder of Tribal Tech. Before founding Tribal Tech, Vicki has had an illustrious career in public service, and I would like to share a little bit of that with you today. Vicki served as the Assistant Deputy Secretary of the Office of Indian Education in the U.S. Department of Education. There, she was the principal point of contact within the federal government for Indian education across the nation. She also served as the Director of Indian Affairs at the U.S. Department of Energy and as the Executive Director of the White House Initiative on Tribal Colleges and Universities. She was an Education Program Specialist in the Office of Indian Education. She served on the President's Commission on Indian Reservation Economics and on the President's Commission on the HIV epidemic. Vicki has a long list of honors and awards, and I just want to share a few highlights with you now. 2020, she was Washington Life Magazine segment Innovators and Disruptors, the 2020 Tech 25. Also in 2020, she was the Enterprising Woman of the Year. She has been on the Tribal Business Journal Honor Roll. She's been the Native Woman Business Owner of the Year. In 2013, she was U.S. Women's Chamber of Commerce Emerging Star Award winner. She has been an American Indian Woman of the Year. And she's also been recognized within the federal government, the U.S. Department of Interior Bureau of Indian Affairs Recognition Award. Vicki has a BS degree from California State University at Fullerton and teaching credentials from the University of California at Irvine. I could not be more thrilled to have her join us today, and I'm going to turn the floor over to her. But before I do, I just want to do a little bit of housekeeping and to say that we really encourage the audience to pose questions. You can do that in one of two ways. There's a Q&A function at the bottom of your screen or someplace on your Zoom screen, depending on how you have it set up. You can pose your questions there. And we also have the chat open. And if you'd like to put something in chat, I'll be moderating these and I will bring these questions forward at the end of Vicki's talk. Vicki, over to you.
Thank you. Thank you, Sally. I really appreciate and I'm honored to be a part of this forum and this series, all for the better good of what we're all trying to do. I also want to give a little shout out to Stephanie, who introduced me to you in the program, and of course to the folks behind the scenes like Grace, Jillian, and my helper, Paul, who's going to be helping me with the slides. So thank you so much. I really appreciate it. And thank you for all those shout outs on those accolades. I don't do that by myself. That takes a village, as they say. I have a wonderful staff and people that work with me, and side by side, we make that happen. So thank you. I am going to put on my glasses because I don't want to make any mistakes here with you all. So if you can go to slide 2 for me, Paul, that'd be great. A little background, I know Sally just gave you some, but I am from Southern California, the San Pasqual Band of Mission Indians. We are located in Valley Center, which is San Diego County, inland from San Diego out by Escondido. My father was tribal chairman of the tribe for almost 20 years, umpteen years ago, long before casinos were even thought of. He was the one that started our first education program, which gave me the passion to get into education and go forward into the teaching world. So I started initially in Southern California as a public school teacher, which I thought that was going to be my career for life. That's what I always wanted to be. And here I am umpteen years later as a former public service for almost 25 years with the federal government in Washington, D.C., and now a proud woman business owner. So we can go next slide. So the background of our business, and I know Sally gave you a little bit, I started Tribal Tech about 10 years ago, and in the end of 2019, I then purchased or acquired Cowan and Associates, which is our subsidiary company and our sister company, however you want to call it. And being American Indian, woman-owned, we've been very fortunate to get some certifications from the federal government, which gives us a priority on some of the work that we've been able to do in providing management and technical services to not only the federal government, but to our state, tribal, and corporate clients. We work very closely, and probably the majority of our contracts are with Health and Human Services, the Department of Health and Human Services. And then we go into DHS, DOD, we've got Department of Energy, Department of Education, which is where my experience comes from. We've got Department of Interior, Department of Justice, Department of Labor. I'm sorry, we put all the acronyms there. I'm one of those that gets angry when everyone talks in acronyms, but here we are. And one of the other proud awards we've been fortunate to receive for the past 7 years, and our fingers are crossed for 2021 as well, is the fastest growing small business with Inc. 5000. We've been very fortunate to be on that list. And I started the company, like I said, almost 10 years ago with one person and me. And now we are here in 2021 with almost 150 employees, if not a tad more. So next slide. What do? We support education initiatives, not only for our Native youth, but we do a lot in our tribal colleges and universities and other higher ed programs throughout the country. My alum, which was mentioned earlier by Sally, Cal State University of Fullerton, I helped them several years ago found their Native program, which had been there, and I'm not going to date myself, but in the 70s, when I was a student. It went away somewhere in the middle, and I was fortunate to be able to help them start that Native program again, which is still going strong today. We also work really hard with the mental health and wellness of our Indian communities and other communities throughout Indian country. My acquisition management and integration services is very prevalent throughout the work we do within and in the DoD space. We work real hard on strategically planning, not only for my company or our company, but strategically planning for others throughout the government and helping them with their management, program management as well. Our goal for 2021 and 2022, our priority is growth and opportunities this next couple of years. Next slide. I'm going to ask you to go. No, that's good. That's good. I was going to flip it, but I think I missed the other one. So we do a lot of the data, and I have to be honest with you. When Sally and Stephanie asked me, would you be a part of our forum? I'm not a smart individual. I did not study data analysis. I did not do statistics and all that work. I think I took one course in statistics that I was required in order to graduate, but it's not my strength. I'm more in the health and wellness side of the world. But you know what it made me do when she asked, and I immediately said yes, it had me look at what do we do with data? And scientific data and quantitative, qualitative, all that. And earlier conversation with Sally and Stephanie, it made me realize you can't run a business or navigate a business without that knowledge. And I didn't even realize how much we depend on it. So I applaud all of you and your students that work in this area. So obviously, as you can see, it allows us to perform our day-to-day activities. It helps us strategize, helps us learn to navigate our efficiency up and down, prioritize, improve our ability to respond to the changing conditions, such as COVID, changed the whole world. Teleworking changed the whole world. We look at our data analysis as it impacts my company and navigating what I need to do with our financial world, our accounting world. And it also, I've learned with COVID, our employees' financial health and wellness. There's statistics out there on the percentages of who's struggling. Not only you, maybe as the employee didn't lose your job, but maybe your significant other or maybe one of your children has had to come back. So those statistics are very important. So not only just in the business, our BD, our business development, our strategic planning, marketing, our management and execution of our management, and then prioritizing where we're going. So the next slide. There we go. So with that and the work that we do that I mentioned earlier with the training, technical assistance, our program management, grants management, events, meeting planning, the logistical work, the research, evaluation, we do all of that, marketing, communication. It is with these challenges. As you can see on the slide, Indian country has over 580 federally recognized tribes. And that's not counting the state recognized tribes that some of the states recognize separately. For example, if anyone's Lumbee, the Lumbees have been recognized for many, many years, but they're only recognized by their state of North Carolina. They do receive some federal assistance, but they're huge. But we do have many tribes, and the reason I point that out is there's no monolithic Indian country. We are separate and unique in our own way. We're very independent. We're all sovereign nations within a sovereign nation, and they do not like to be referred to as under the government of that state. They want to be a government to government recognized relationship. And when it comes to the data, which I had a discussion with some of the folks earlier, was it could be something different for my tribe in Southern California versus a tribe up in North Dakota or South Dakota. So it's very difficult to say, okay, here's a statistic and it's going to work or help us work better in that particular area. It may not. So it's hard. And I have a map, I think it's coming up, but that will help you see the visual of where the tribes are. Our business operations, our acquisition has led us to new opportunities. For example, I heard Sally say the Darden School of Business. Coincidentally, we are helping with the Navy side at the School of Darden for our retired military. And we have folks from our Cowan and Associates that help teach that program. So, wow, I didn't know we were all connected in that way. So we do some of that. We also do some IT work that is bigger than just web work that we do or help desk under the Cowan side. So we help with some training and program management and support for specifically a lot of the Navy entities on that side. So the next slide. So I know for me, if I didn't have my glasses on, I can't read that. So you need to put your glasses on, and you can get this through the Bureau of Indian Affairs. Just Google BIA and you can look through, and they'll have the map that shows all the federally recognized tribes. So the little lines there where you see, let's go to California, you can see, or Alaska, those are all different tribes, federally recognized tribes. So when I say they're sovereign nations, that kind of gives you a bigger picture. We have a few here in Florida, a few up in the Northeast, but it's pretty prevalent. You can see over on the west side and in Alaska. So that's, I thought, as a visual, when I'm saying how do there's, if we could all just come together, be one monolithic entity, we'd be powerful, but they stay separate and unique. Not to get political, but I can tell you when they finally got their little resources together in states like Arizona, they became powerful and made a difference in some of those elections that wouldn't have happened otherwise. But next slide. So the solution, balancing sources, types of data, balancing the types of data. The federal and state governments obviously have enormous amounts of quantitative data, as I'm sure a lot of the schools do as well. We have to manipulate and analyze that data to make it work for us, to make it work for the work that we're doing within Indian country. So you have to take a look at those that kind of have unique and special data, such as I'm going to name these so that you don't have to figure out the acronym. The Substance Abuse Mental Health Service Administration, which I'm going to talk about in a moment, the National Indian Education Statistical entity, the National Congress of American Indians, which is the largest, oldest organization in the United States that recognizes is the voice for our federally recognized tribes. ED stands for the Department of Education. Within the Department of Education is the Office of Indian Education, where we have also under the Department of Interior, the Bureau of Indian Education. Then we have the Administration for Native Americans. So we utilize a lot of that data to help us do the work that we need to do within those entities. The tribal data collection looks a little different. It's mostly qualitative. Why we rely on the verifiable data is to be able to derive the actionable information for example, with COVID in the Indian Health Service, the percentages of the COVID that was the highest came out of the Indian Health Service, telling us that Navajo, Phoenix, Arizona, and Oklahoma City were our highest. And then that was reported from CDC, Indian Health Service. But then you go to the tribes and they'll have about saying maybe it's about 50% of that area. So your tribes and your Indian organizations might be a little different than what you're getting from the federal resources. So we got to pay attention to both. We got to do both. And where I hope some of the students in the program can help us do that throughout Indian country as well. So the next slide. So back to getting into the mental and behavioral health for our tribal folks throughout Indian country. Unfortunately, one of our biggest issues is suicide, and the ages of 10 to 34. We've had individuals in one specific tribe, for example, say 4 or 5 youth will form a pack and decide to do a joint suicide. So that really is a devastating issue that occurs in that particular Indian community. And so that's where we go out and try and help heal that community. The death rate from suicide with our adults is about 20% higher than the non-natives. Our adolescent females have a death rate that's about 3 times higher than our non-native groups in our 15 to 19 age group, which I'll get into another group of our young women to talk about in a few moments. 9.8% of our Indian Health Service tests have been positive since the onset of the pandemic. So we're getting a little better with COVID, as I mentioned earlier, and it now stands at 6.4%. The Christmas holiday kind of set us back, including at San Pasquale. A lot of my family and relatives out there hadn't gone anywhere and decided to go do a couple stores, go shopping, get those gifts that they didn't get online, and got hit with COVID and are still, a couple months later, still recovering. But thank goodness, knock on wood, everyone is doing well, and now hopefully the vaccine's going to help. So the next one, I'm trying to get my other note here. This is, sadly, we do this work. Gratefully, we do this work for SAMHSA. I'm now going to use the acronym. We help this agency just in Indian country. And you have to understand, SAMHSA works for all people. We have just the piece for Indian country, and that is to help with drug addiction, alcohol addiction, suicides, opioids, bullying, domestic abuse, COVID now. So we work on those issues. And as you can see, the suicide is just disproportionately larger with our American Indians and Alaska Natives. The rate among our American Indian and Alaska Natives has been increasing since 2003. And in 2015, the rates in the 18 states that participated in the National Violent Death Reporting System was 21.5 per 100,000, more than 3.5 times higher than those among other ethnic groups. Now, I have to tell you, even though that statistic is telling you to 2015, it's in 2020, 2021, still one of our highest. So we've got data collections going on with that Native group or national group to help us with the Native numbers as well. We can go on to the next one. Oops, I put it down. The missing and murdered Indigenous women. This is unfortunately something that's been going on for years, but no one's really paid attention. And I am saying this was going on even within our own Native communities and no one paying attention. Now it is prevalent. The numbers may not seem huge to you, but they're huge to that Native community. So in January of 2019, we had very little data on who these missing Indigenous women and girls were. And I say Indigenous because we include all Indigenous people, not just our Native women. There is a serious lack of meaningful government data documenting these rates of these young women that are missing and murdered. Fortunately, Congress now has taken this on. Several other organizations have taken this on, and individuals are taking this on to fight this serious issue that we have throughout the country. In November of 2019, comprehensive data analysis, the Justice Department is taking this on. So they performed in-depth analysis of the federally supported databases and analyzed that data collection practices to identify opportunities where we can improve these data reports that are coming out, and hopefully can share these results and help us work in a better way with other partners, and more importantly to Congress, so they can bring this to the forefront and help us fight this. Again, I'm assuming you get these slides because I have the two links for you if you would like to be involved or help us with this issue, with the work that you all do. I wanted to share this as a little piece that is a big crisis in Indian country. The next slide gives you a little more of a number. And again, they may not seem huge to you, but in the Indian world, it's huge to us. And so we've got 506 of the missing, murdered Indigenous women cases identified across 71 urban cities. We've got 128 cases of missing Indigenous women. 280 were cases of murdered Indigenous women. 98 were cases with an unknown status. 29 is the median age of our victims. So I don't like to end with something, that's sad but it is important that you all know this information and help us with some of this data. And then the next slide is solutions, market research, business case analysis, all important, measuring program effectiveness, long-term planning, utilizing our government resources to gather information. We just need to get more resources that are important coming out of the government. Training, we try to do training and analyze that, what's good, what's bad. The data to improve our services, we need to know that, the market research on the industry, forming our strategic analysis where we can, financial analytics, both internally and externally. We also do work at OPM, the Office of Personnel Management, which if any of you are federal employees, you would know of the Combined Federal Campaign, and the CFC is a the organization that receives the charitable contributions from all of our federal public servants. So we have to help them with the donations and let them know what the numbers are or aren't. We need to let them know strategically around the country, actually internationally, because of our military bases. We help them with that. And we also help with volunteers. We help conduct focus groups. So some of that is part of the work we do under the market and research. And that's just a little piece we do for OPM. Now I'm going to come to a close on a couple things so we can maybe do some chatting. I don't know, how we're going to do that, but we're going to do it. So the next two slides, the next one is an offer. We're always looking for interns. I did see on the website of Sally's group and Stephanie's group that you have programs for interns and so forth, but I want you to know if there's someone out there that is interested, we do like to get volunteers with our Native Connections program under SAMHSA, as well as our training and technical assistance program, so that we can teach the students today to maybe come after graduation and work for Tribal Tech. So, but we just had two this summer, and they had to do it all virtual, and they're going to come and work for us, assuming we get the contract again. But it's great work, and we also have other opportunities for interns in Tribal Tech and Cowan that someone may be interested in learning, and I've also learned part of an internship program is to find out what you don't want to do. We had a Native student come, and he loved doing what we were doing, and he said the year before he had went back to his tribe because he always wanted to, after college, go back and work for his tribe. And when he did the internship for his tribe, he realized, I don't want to go back and work for my tribe. I want to come and work in the policy and other areas to help. So you do find out what you don't want to do in an internship as well. And then the last slide, I'm very proud and very fortunate to be able to try and continue the legacy of my dad. I get a little emotional, but again, he's the one that started the first education program, like I said earlier, and again, long before casinos. And it got me thinking, what can I do to keep him going? So I'm, knock on wood again, being so successful in the work that we do for the Indian country and the government, it afforded me the opportunity to create a foundation. And it's the Ronald Mays Peralta Foundation, where we like to serve the American Indian and Alaska Native peoples, but we serve all people. There's a lot of things that we do that aren't necessarily in the Native communities, but we try to help in the educational world and the health and wellness world. And certainly my father was a huge fan of our youth, especially our Native youth. And to the point when he retired, he became a crossing guard so he could walk those little kids across the street and spoil them with candy. But so we want to promote healthy communities and do a lot of the good work that you all do as well. And I would like to surprise Sally and Stephanie. And Stephanie and I have a mutual friend, and I want to do this for her as well. But Sally, I'd like to give a contribution or a donation to the good work that you all do. And maybe there's a student in your student program that would need a little push for a little scholarship, a little something, and could help us in some way. And I don't mean us, meaning Vicki, Vasques, Tribal Tech, but something that could bring about some more data and information that we aren't doing. and could be very beneficial. Or maybe you have a Native student that's a part of your program that needs that little extra scholarship to go forward. So I pledge to provide $5,000 to the program. So.
Well, Vicki, thank you so much. That's very generous, and I'm sure that our co-leads of our data science for the Public Good Young Scholars Program that are listening in, that their ears just perked up. So we'll definitely be back in touch on that.
Yes, and
so
we can. We'll work all those logistics out later.
Exactly.
But
But thank you. That's wonderful.
I loved reading what they all do. I looked it all up. I'm a good person to follow that. But I thought, how can I help? And maybe somebody will be interested. And then here's our last slide that gives you contact information. I'm sure if any of the students need it, they can reach out to you all. But if they receive the slide, they've got it.
Thank you.
So thank you.
Vicki, thank you so much. I will kick things off here. We have a few things in the chat that I'll share with you in a minute. But first of all, I just want to thank you for, such an interesting presentation. And, it was just really shocking, some of the data and evidence that you were able to present on the tribal areas. And so I think that it's a really ripe area for partnering and for thinking about how we can even bring more data and evidence into this space to help support the work that you and others do. I was very, I think we're all very excited to, to see Representative Deb Haaland, get nominated as a cabinet secretary. And I was curious about what your thoughts are on what one hopes she can do to help push forward and the the good work that you do and the good work that others do. I mean, what can we hope to see coming out of her office?
Oh, I'm so glad you mentioned her. As a Native person, many times I was offered positions, obviously, to do Native work, but I loved the positions that I got offered that were non-traditional Native, like Director of Scheduling and Logistics for the Secretary of Energy. That would not normally be an Indian woman. So I loved that I had that opportunity and got to do that work and wasn't just pigeonholed in the Indian desk. Well, for an Indian woman, and I don't care politically if you're on this side or that side, it doesn't matter, to see a Native woman nominated, let's hope she gets in, Secretary of Interior, not the Bureau of Indian Affairs Assistant Secretary, but Secretary of Interior, which oversees a lot in our nation. The national parks, they have energy, huge department. And we have a Native woman that may lead that department. And I know we will have a voice now. We've had a voice, but it's always been in the assistant secretary level. But to be at the cabinet level, and I don't know if you've all noticed, when the president speaks, he says states, tribal, territories. That's unusual in all my years of service. And we've had many presidents support the Native issues, truly. But to hear it today from a president when he's talking about healthcare or COVID or small businesses, he will say, if you start listening, he includes tribal, and we applaud that. So I'm thrilled to see. I always said I'd love to be an ambassador to somewhere, and be the first Native woman ambassador. But I'm not political in that regard, and I don't have enough money to pay for one or whatever they do nowadays.
So Vicki, we have several people who were asking questions about where to get more information around internships and opportunities, not just in our area, but in Chicago and other areas. And I think that we will make sure that we post the slide that has the contact information and encourage people to go to Tribal Tech site. And I'm sure you can reach out to Vicki directly to get some of that information.
Another area is that people don't think of, like I said Cal State Fullerton has their Indian program. UCLA, Stanford, Harvard, Dartmouth, the big schools too. I mean, UVA, I don't know about you, but many of our universities throughout the country have Native programs that you can participate in and or do internships with, as well as we have about 30 some tribal colleges and universities throughout the country
Right.
as well.
So let's get into a few questions about some of the data and other information. So we've had a question, and it was one that I wondered about as well. You mentioned local and federal data. Do all of your data come from the federal government, or are you able to integrate some local data from the tribes right into the work that you do?
Some of the work that we actually do with the department, and I say federal because we are funded by the federal government to do the work that we do, not only for them, but it's going to benefit out in Indian country. For example, the National Indian Education Study, we are fortunate to be able to do that and have done that for the past few years. Unfortunately, COVID has stopped the work where we are literally calling the schools to get the information we need. It will start up again soon, but the last 9 months, we haven't been able to get that data. But it's to find out, where are kids in second to fourth, or where are they in 4 to 6? What are the needs? So it is the federal government, but it's also working with the tribes. Then there are other entities, non-native entities actually as well, that go out and do different studies and research and evaluation for whatever the issue may be that we'd like to know about. Right now, the big one is the COVID statistics.
Right. Well, following up on that a little bit, there was also a question about when you referred to lack of data with regard to the missing and murdered Indigenous women. What data are you missing?
Is where, we gave you a little bit on that slide, but how accurate is that? That's just a little piece that we've been able to get from sources that are more local, but the where, the numbers, the services that are needed. We've got the missing and the murdered, which one is, I hate to say higher, but there are larger numbers, but getting some resources to the people that want to do that work for the data collection is the hard part. However, as I noted, the Department of Justice has taken this on, and Congress is now supporting it and discussing it. So I think the funding is going to come to help us get the data that's needed. Because in the past, those women were, it was just someone that was on drugs.
Oh.
Yeah, and that's not necessarily the case.
And are you able to conduct surveys in the communities? And are these accessible to the public, or what's I know you spoke to Stephanie and I a little bit about that when we met.
That's a good question, because in some areas you're not welcomed. I'm just going to be blunt. In some areas you're not welcome. Nobody wants to answer your survey. Nobody wants to do your census. Nobody wants to do. They don't see the purpose in some respect. There's a lot of distrust, mistrust in our Native communities. However, when you get the validation of the data that you're trying to accomplish and move forward, then you can take that step. But that is one of the challenges that you come up against. Same, when the federal government wants to come in and do some sort of statistical analysis or data analysis, be it scientific or not, they're like, no, you're not coming in. So we've got to work very closely with our Native people and our tribal leaders to make that happen.
And and a couple more questions on data, then we'll come back to a couple questions on information technology. Can you highlight some of the key takeaways that the COVID-19 data are telling you about how the tribal nations are faring during the pandemic?
We worked with this, we worked for about 3 or 4 months, I would say, with the Muskogee Nation, which is located in Oklahoma. Sadly, they were given, well, I shouldn't use that word. They were fortunate to be given legislated an amount of money, which was huge. And what happened with, including with the Muskogees and the rest of the tribes, the money just was given. There was no direction, no support. What are you going to do with it? And so, unfortunately, the majority of our tribal members saw that as a way to get a per capita. We don't care about COVID. We don't care about our health, PPP, the emergency needs, the vaccines, the testing. Just give us our per capita. Because there was a distrust. However, when you get the tribal council together where they can organize and formulate a mission that needs to be accomplished, then it makes sense. So the data, I don't say that was a focus. The focus was more on how are we going to help our community get well. They knew they had COVID, but they didn't know how to test them. They didn't have those resources. So the data is just coming out from the Indian Health Service and the CDC on what we need, where we're going, just like the little bit of data that I included after the holidays, they've showed we've had a reduction. But it's not, we are our own worst enemies, I think, when it comes to the information that's needed.
And then what about other issues of importance in the communities, and in particular, things around and related to education?
Well, one of the big issues on education, when you look at we have, just to explain the education, we have public schools, we have charter schools, we have parochial schools, and we have Indian schools. And what I mean by Indian schools, these are Bureau of Indian Affairs controlled schools. Oh, and we might have a tribal school. So that's a lot of schools on a reservation that you got to figure out. So one of the big issues with our Indian schools is the construction. I mean literally the construction. So they're falling apart. The kids are studying in, warm coats. Then the second thing, which we did learn from COVID, was the broadband. They're out in rural communities. Not all our schools are right there in the middle of, Bismarck. They're somewhere out there in fields. And so that's another area that we learned. What do you call it? Virtual learning.
Yeah.
Now,
well, and kind of to that point, another question that had come in is, have you found an increase in access to technology is helpful to bring to light more information and discrepancies in the Native Indian communities?
Well, because of COVID and everyone having to go virtual, including our kids and the public school kids, they had to quickly figure out, how do we get something as easy as a computer, as a laptop or a iPad or something for those kids to have. But then how are they going to get the what do you call it, the Wi-Fi, the broadband that's going to help hook it up? So that is, as much as I didn't want to ever see COVID or that happen, it really got our state and local governments working to provide that to our Indian communities, because it was brought forth. And
switching gears just a little bit, I think this is a great question. Could you speak a little bit more about the work with the Army? Native Americans have traditionally been overrepresented in the armed forces relative to other groups. Are there particular issues that you find need to be addressed in this at this intersection that is different from the issues of non-service members in the Native community?
That's another good question, because that is one of the reasons I I acquired, or I wanted to acquire another company in a completely different space. And that was Cowan and Associates, a Department of Defense contractor. However, we do Navy, not the Army. I am an Army brat, though. My father was the 101st Airborne for Fort Campbell, Kentucky. So anyway, but here's why I wanted to step into the military. They have almost identical issues that we have. Their suicide is high, especially now. Their domestic abuse is high, especially now. They have addiction, and their addiction may not be addiction to drugs and alcohol, even though that is prevalent as well. But there's servicemen and women that go out into the hinterlands and they're on those games, and they work all night on those games, and then they have to get up and work all day. So that's an addiction that we really need to address. Now, I don't know the answers. I'm still trying to talk to the military and say, I know we can help you, but, and they know they have issues. So for me, it's not really the work that we're doing that I acquired in the program management, the IT, the security, the cyber, the obvious things that one does under IT. It was me seeing that there is similarities to the work that we do, the important work that we do on those addiction sides. That, gosh, and when I get there, I'm going to feel like I can sit back and say, okay, I did it. I got people there.
And, coming back to some of the addiction and other issues that you brought up, do you have any programs for preventing suicide? And are there some qualitative data that go along with this as well? Are you able to conduct these maybe surveys and qualitative studies for this?
Yeah, I don't want to say we, Tribal Tech, has the answer, like, okay, here's the script for suicide, or here's the script for drug addiction. We have, and again, we do it for Indian country, and I can see doing that on the military side. We have what we call our Native Connections, which is our on-hands technical assistance and training that's culturally appropriate to help with prevention and to help promote wellness. So there's no like literal, we're going to tell you, if you do these 3 things, you're not going to have suicide. We're there to help you with the prevention as best we can, also with the healing when something has occurred that's been really a crisis in that community. But then we also have services to provide you on the health and wellness of your community to help promote that. And this isn't just an hour webinar, which we do webinars, but it could be a 2 or 3 day program. We had, I would say on average, 700 site visits until COVID, annually. During COVID, it was probably in person, 700, probably 600 in person. We did get later during COVID, they allowed us to go into the tribal communities for almost 100 visits as long as we traveled by car. And when I say we, are subject matter experts that are trained and educated in that particular issue that's hit that particular community. So there's no right or wrong answer. We know there are numbers out there that tell us that we have these issues, but we're doing the best we can to do it in Indian communities with 1, 2, 3 day sessions that they need. And they may think they only need an hour, but it'll lead to something else. And I wish you could meet the employees that do this work, because they are phenomenal. They will go at a drop when some crisis hits out into the particular
And
Sorry.
what supports this work? It's government funded, isn't that correct?
Yeah, for that work for us is the Substance Abuse
The SAMHSA.
Mental Health Service Administration. The acronym is SAMHSA. It's
Mhm.
under the Health and Human Services.
Right.
And again, we just do the piece for the Native communities. They service, SAMHSA is huge. They service all people for substance abuse, mental health service. You know, that's their mission. But we several years back partnered with someone. That's another thing. Partnerships are very important when you do the work that we do. And one of our partners really helped springboard us to help with these communities. And now we're doing that work. We're also doing that work, by the way, separate from the federal government. We probably have about, 10, 20 sadly, individual contracts with tribes directly to do that work because they feel they need more than what they can get through the government. So we were honored to be selected to do some of that work independently of the federal government as just for the tribes.
Well, we have one more question, and it seems extremely appropriate to end with this question. And it's, what about the census? Census 2020. Do you think the estimates that will be coming out are going to be, correct and accurate, or what are the challenges that the tribal nations face with the census?
Yeah, I know that they did the National Congress of American Indians, which is that big organization I was telling you about. I know they did a big push for everybody to participate in the census. Unfortunately, a lot of that had to happen during COVID, and who knows? I'm not. I don't follow the census as well, but I know they missed a lot just on the work we're trying to do. Like I said, with Indian education, we had to stop. So I don't know. And then I'm hoping people are truthful. All of a sudden, it's popular to be Indian. Well, okay, but are you really? So we need the census. We need that data and those statistics because it helps us when we need the services.
Right.
But I think as important as the census, it's more important that the federal government recognizes that these are sovereign nations. They already have trust responsibilities. They already have to be government to government and work with us. So that's just as important as if a number comes out and tells us we need it.
Well, I want to thank you. I want to make another call out, though. We've had a couple of our attendees remark that Sally Jewell, Secretary of Interior under Obama, did make a point to acknowledge tribes. You had indicated that different secretaries had, and this is one that definitely some of our attendees are very familiar with. Now, I also want to thank you again for the incredibly generous donation that you're going to be providing to help a young scholar get engaged with this work. I know a lot of the people who have been asking these questions, and I can assure you that it's several of our young scholars that jumped on this Q&A. So I'm very excited to see that. So thank you, Vicki. Thank you so much. And everybody, thank you for joining us today. Our next forum event is March 31st. It will again be virtual, and it'll be Hadley Wickham, who will be quite popular from our studio. Good. So we hope to see everybody then.
Thank you so much.
Thank you, Vicki.